develop the in-house dissolution method. This is the topic for the present video, and in this video we are going to see when it is required that the dissolution method is to be developed. We know that there are the methods available in the literature. We can get it through the monographs like USP monograph, BP monograph. Also, we can do the literature search and we can get the dissolution method. The US FDA also provides the dissolution database for the dissolution methods, but sometimes it is required that the in-house dissolution method is to be developed. So this video will give you the complete understanding when to develop the in-house method for dissolution testing. The first reason is lack of suitable USP method or pharmacopoeia method or monograph method. So if there is no monograph available, if there is no official or recognized method available in the references like USP, BP, JP, and that matches the specific formulation or dosage form, so that time we need to develop an in-house method. Also, when a novel drug formulation or a non-traditional dosage form like CR, tablet, implants or patches are prepared, that doesn't have the compendial dissolution method, so that time also we need to develop the in-house method. For example, if you are working on to a novel formulation like extended release formulation, and in the monograph only IR formulation dissolution method is available, that time for the novel formulation new method, in-house method is to be developed. Then second reason is modification of an existing formulation or existing dosage form. If a standard compendial method exists but the formulation undergoes changes, that may significantly affect the dissolution behavior. Like there is change in the excipient, change in the formulation design, change in the dosage form, or change in the release mechanism. If a tablet composition or release profile is altered, requiring adjustment for the dissolution method to account for new formulation variables, that time in-house method is required. Example I can give you, like if the available formulation method is with immediate release, or you are working on to a combination type of formulation, that time some modifications are made to the formulation, and so the new method is to be developed. Product development and formulation optimization. So during early development phases or during formulation optimization phase for the new drug, an in-house method is required to monitor and understand the dissolution profile. Developing a new sustained release product where dissolution characteristics are critical in optimizing the release rate and ensuring the bioavailability. If you are working on to the new sustained release product, new extended release product, new controlled release formulation, that time in-house method is must. Regulatory requirements for special or novel products. Regulatory authorities require customized testing method for specialized formulations when these formulations are highly innovative, novel, or are unique in nature. That time the new formulation to be tested with the in-house method to justify the dissolution method. Discriminatory method is required to be developed, and mainly whenever you are providing the justification for discrimination, that time certain changes are to be done to the dissolution method if still the method is available. So it will lead to the development of new in-house method. A drug that uses new delivery system or a unique polymer matrix where dissolution characteristics are critical for the efficacy, that time in-house testing is required. Ensuring robustness and specificity for stability testing. Custom dissolution method may be needed for stability studies to monitor how a drug product behaves under various environmental conditions like temperature, humidity. A product that is highly sensitive to environmental conditions, necessitating a tailored method to assess stability throughout its shelf life. It is very important that during stability testing, the product should be stable. Also, product behavior is required to be tested through a suitable dissolution method. That's why, to ensure the robustness and specificity for stability testing, method is required to be developed. Then another reason is when dissolution results vary between the labs. If in case significant discrepancies are observed in the dissolution profile between lab or the testing center, in an in-house method can help to standardize the testing procedure and improve consistency. For example, if the monograph method is with paddle 900 rpm, 50 rpm, 900 ml and 50 rpm, and in-house method is with 60 rpm, that time the method with 60 rpm paddle can give you more consistency compared to the 50 rpm, and that rpm is required to be justified and it is required to be shown discriminatory. So depending upon the formulations also, the methods are required to be changed and in-house methods required to be developed. During routine quality control, when cross-lab reproducibility is an issue, creating a lab-specific dissolution method can help to achieve reliable results. So is it okay or not? You can comment. You cannot develop the lab-specific method. The dissolution method should be specific to the product and not to the lab. Whenever you come across such issues and you want some solution to that, you can go to the literature, you can go to the USP monograph, BP monographs, and can have the understanding. If you have any questions also, can comment me. I will try to answer your queries. Then, to address specific challenges in the analytical testing, some drugs are BCS class 2 and 4 with low solubility. Some are with poor stability or complex release profiles that are not well represented by the standard methods. That time, the in-house method will help. Developing a method for drugs with poor solubility in standard media or those that require sinkers to prevent floating during dissolution. That time, you need to do some changes, updation to the existing method as well, and can develop a new method. Formulation or method improvement. To improve and refine the existing dissolution method based on findings in early stage research or when there are gaps or inconsistencies in the current method. Refining a dissolution method to enhance sensitivity for drugs with low solubility or to better detect small variations in the release profiles. Sometimes new guidelines get updated or new guidelines come with the new requirement, like BCS guideline is there. For BCS class 1 and 3, standard dissolution conditions are given and media is given like 0.1 normal HCl acidic media. So if such changes appear from the regulatory authorities, if some requirements are there, that time also we need to develop a new method. Then another reason is non-bioequivalence of generic products. If a generic product shows significant differences in dissolution profile compared to the innovator drug, then an in-house method may be necessary to address and identify the potential causes. Because there are some manufacturing changes, there are some composition differences, changes in the API source, changes in the ROS of the API, changes in the particle size, compared to the innovator formulation. So we cannot say that the innovator or the available method will work for your formulation also. Addressing dissolution challenges in generics that do not match with the innovator's product profile or release characteristics. Another reason is customized testing for biopharmaceutical classification system. For the drugs categorized as BCS class 2, low solubility, high permeability, develop a specific dissolution method to better understand and replicate the in vivo drug release is often required. As I have mentioned, the dissolution is an in vitro test to understand about the in vivo nature of the formulation. So these methods should be discriminatory. This method should be specific and scientific, and it should be able to give you understanding about the in vivo drug release. For drugs with poor solubility that need specific media conditions to better simulate the GI environment. Regulatory submission requirements for new drug applications or ANDA or NDA. Regulatory submissions might require the development of validated in-house dissolution method as a part of submission package to demonstrate drug release profile and consistency. New chemical entities or new formulations requiring tailored dissolution methods for approval. Nowadays, regulatory bodies are becoming very stringent, and these regulatory authorities require discriminatory dissolution method. So, the in-house method will give you the advantage of justifying the discriminatory nature also. Many times, the USP methods are taken as such for the product for dissolution testing, and then it becomes very difficult to justify the discriminatory nature. So always understand about the product nature and then understand is there a requirement of in-house dissolution method or not. So I hope this video will guide you for the in-house dissolution method development when there is a requirement and when it is must to develop in-house method. Thank you for watching the video, and I request you to do like, share and subscribe to this channel. Thank you.